This is the pelvis. As you can see, in the female, there are some very important organs here. But there are some things that you are doing that may be causing damage to these organs and can lead to infertility.
Hello everybody and welcome to Irene Talks. My name is Dr. Irene. If you're watching me for the first time, you are welcome. If you're a returning viewer, you are also welcome. If you've been watching me but you're not subscribed yet, come on. What are you waiting for? Subscribe! Subscribe, like, share, follow us on social media. We are on Instagram, we're on Facebook, and just get to see what we have. Sometimes I post things on Facebook that are not on YouTube, and sometimes I post things on Instagram that are not on Facebook or YouTube. So you can follow us on all our platforms.
So today we'll talk about pelvic infections and we will be focusing on PID, that is pelvic inflammatory disease.
Women. I remember we talked about things that can cause a woman not to have ovulation. And today we are focusing on this pelvic infection, as I said. This is one of the biggest cause of infertility in women. We're going to be looking at who can get it, how they can get it, how you recognize that you have it, how you can prevent it, and how you can treat it. So these are the things that we're going to be looking at today. So stay tuned. Because of how the organs are linked in the pelvis, they are linked by blood vessels and things like that. Any infection that happens to any of the organs will quickly spread to the rest. So the body has to find a way of defending itself. It defends itself in various ways.
So the vagina is what links the outside with the inside. It's like the door of a house, for example, or the gate to a compound. It has some very important bodyguards that prevent unwanted guests from coming in. These bodyguards are controlled by the boss, estrogen, and they work only when the boss is around. Estrogen controls the thickness of the wall of the vagina. It controls the pH, that is how acidic or alkalinic the vagina is, and it controls the normal biological environment of the vagina. However, there are different phases in the life of a woman where the boss is not in town or the estrogen level is low. In those phases, the bodyguards are not working, so the vaginal defense is low, and unwanted guests can just stroll in. In times like this, it is important to maintain a high level of personal hygiene. The first phase is 10 days after her birth until her puberty. The second phase is during her menstruation. The next phase is the period after childbirth or miscarriage or abortion. And the final phase is during menopause. So be careful not to allow unwanted guests in by maintaining optimum hygiene in this period. Aside from vaginal defense, we also have cervical defense. This is the cervix. It is a very important area in the female reproductive system. It is what connects the vagina to the womb. It is also the area that will dilate and widen during labor for natural delivery to happen. It protects itself by producing a lot of mucus that kills bacteria. And then we have the fallopian tubes. They protect themselves with a wave-like motion called peristalsis. Peristalsis is the same movement that occurs when you swallow food or water, for example. They also have a hair-like structure in them that moves constantly. This structure is called cilia. They both move things towards the womb, so nothing stays in the tubes.
In as much as the body tries to prevent you from infection with the necessary mechanism, it will fail if you continuously expose yourself and expose your body to infection by not maintaining proper hygiene or by indulging in unsafe sexual practices. So we spoke about the disease. Now let's talk about the infection. As I said, today we'll be focusing on an infection or a disease called pelvic inflammatory disease.
So PID is the spread of infection or inflammation, that is swelling of these organs, the upper genital tract organ. That is the infection and swelling of the womb, of the fallopian tube, of the ovaries, and of any other structure that is surrounding that area.
If you ever had a sexually transmitted infection, that is an STI or STD, especially if you had or have one and you didn't know about it and wasn't treated. If you have multiple sexual partners, or you're in a monogamous relationship and your partner has or had multiple sexual partners, this will increase the risk of having STI and the risk of having PID. Sexually active below the age of 25. IUD stands for intrauterine device. That is a contraceptive device put inside the womb to prevent pregnancy. It is uncommon to get an infection for these procedures, but it is possible if proper sterile conditions are not followed by the doctor. Many women douche with store-bought packages that contain mixture of fluids, and these has been linked with PID.
It can be caused by different bacteria. It can also be caused by some viruses and even parasites. However, majority is caused by STI, especially chlamydia and gonorrhea. It can also be as a result of unhygienic delivery conditions or abortion clinics. As I stated earlier, it could be as a result of IUD insertion and rarely tuberculosis.
Some people can be asymptomatic, that is, they do not show any symptoms. Some can have mild symptoms, some can have moderate symptoms, some can even have severe symptoms.
Okay guys, so I just realized this is a tongue twister. Try saying some can have really fast 5 times and send me a video and let's see who can actually say it.
There is no way of knowing how bad your symptoms will be. But some common symptoms that are seen in this disease are
severe lower abdominal pain, fever, nausea and or vomiting, abnormal vaginal discharge with bad smell. You could also have menstrual irregularities, that is, you're having your period at all times, and it is also possible to have heavy prolonged bleeding. Abstinence, practicing safe sex, getting tested and adequately screened for STIs, not douching, adopting and maintaining good hygiene. Most cases may require a combination of antibiotics that is prescribed by the doctor and can be taken at home. However, in some complicated cases, you may require surgery or you may require hospital admission.
So that will be all for today. I hope you learned something new. Remember to like, subscribe and share this video with your friends and loved ones so that they can learn something as well. Stay tuned for more episodes on our infertility series and have a wonderful day guys. Bye.